The neurological examination of the lower limbs.
Nice to meet you. I'd like to examine your legs, and we're going to begin then by seeing what your walking is like. Okay. So if you wouldn't mind just hopping out of bed, please, and just stand up by the edge of the bed. Do you feel steady?
If the patient is able to walk, start by examining
just walk to
gait.
the end of the wall.
The legs need to be uncovered. Use this opportunity to make a general inspection.
Thank you. Stop right there. Turn around and just come back towards the bed again. Okay, stop there. What I'd like you to do now is to walk with your heel
to toe walking is a test of cerebellar function. Look for unsteadiness and any leaning to one side. Is the gait typical of any particular abnormality?
What I'd like you to do now is to stand on your toes and to take a few steps.
An S1 lesion makes this difficult.
That's good. Thanks. And now just on your heels and take a few more steps.
An L4 or L5 lesion will make this difficult.
All right, just come this way. You can turn around. And what I'd like you to do now is to squat like this.
A proximal muscle weakness will make this difficult.
Okay.
Now test station. Stand close enough to the patient to steady him or her if necessary.
Even your feet completely together like that. Good. And your hands straight out like that with the palms up. Now I'll be close in case you become unsteady.
Slight swaying is normal, but marked unsteadiness when the eyes are open suggests cerebellar or vestibular disease. Romberg sign is positive if unsteadiness increases markedly when the eyes are closed. It is a sign of proprioceptive loss.
All right, that's very good. All right, open your eyes, and if you wouldn't mind just hopping back into bed.
Now ask the patient to lie down. Keep the legs exposed. Look for muscle abnormalities and fasciculations and tremor. Test tone at the knees and ankles.
I'd like you to stay just very loose so I can roll your leg and flop and be loose and floppy. That's good.
There should be little muscle resistance to these movements if the patient is relaxed.
And stay loose for me. Very good.
Next, test for clonus of the ankle and knee. This is a sustained rhythmical contraction of the muscles when put under sudden stretch. It is due to an increased muscle tone. Patellar clonus is tested next. Now test power. Start with hip flexion.
Is lift this leg straight up in the air. Push hard against me. Push hard. That's it. Good. And this leg. Push hard up. Good.
Then hip extension.
Now, I'd like you to drive your leg back into the bed. Push down hard. Okay. And again, push down hard.
Now hip abduction.
Push your legs apart as firmly as you can. That's it. Good.
Now hip adduction.
Again, pull your legs together. Good.
Now test knee flexion.
I'd like you to bend your knees for me. Bring them both up. Good. Now hold it in that position and don't let me straighten it. Hold it. Good. And this one. Hold it in that position. Good.
Now test knee extension.
Now straighten your leg for me. Push out. Kick out. That's it. Kick this leg out. Good. You can straighten your legs again. Down.
Now test the ankle joint. Plantar flexion.
What I'd like you to do now is to press your foot down against my hand and your toe as well. Curl your toe down. Good. Push this foot down, toes as well. That toe as well. Push down hard.
Dorsiflexion.
Now I'd like you to bring this foot up towards, or toes up towards your face. Foot and toes. Good. And this one. Toes and foot.
Now test the tarsal joint. Eversion.
What I'd like you to do
Inversion.
now is to put your feet out, away from each other like that. That's it. Keep it in that position. Push out. Good. Now put your feet in so that they face each other. More like that. Relax a bit. More like that, so that they're facing each other. That's it. Hold it there. And hold it there.